It's a pleasure for me to be there for the first time in IIS conference, and I would like to thank the conference organization to invited me. I would like also to apologize for my bad English, but I hope that you will understand what I say. I will try to explain you our program in Côte d'Ivoire in HIV in prison, and my presentation will be about the co-infection of tuberculosis and HIV in prison in our country. Côte d'Ivoire is the most affected country in West Africa with an HIV rate of 3.7%. MACA, who means Maison d'Arrêt de Correction d'Abidjan, is the main prison in Côte d'Ivoire, the biggest one in the capital, and with 5,000 prison inmates, which represent 50% of the prison population of all the country. It is overpopulated. It's a prison that was made for 1,500. So there is an overpopulation of 300%. Our activity has shown that the HIV in MACA rate was 5.5%, with a big differences between men and women. Men was 4.6 and women were 14.1. And before 2008, the management of HIV in prison almost doesn't exist. This is why ESTHER, in collaboration with the Ivorian authorities, made the project who made trainings between MACA and the French hospital, which is teaching hospital of Bordeaux, to improve the treatment and care of HIV in prison. This program, during 4 years, gives good result, and since 2 years, ESTHER has been a sub-recipient of National Health Program to extend the program to 22 prisons in Côte d'Ivoire. You have to know that there is only in MACA that there is medical doctors. In the other prison, there is no doctors. Some have just nurses or male nurses. So this program is to create a vacation of medical doctors in prison who has no doctor for treatment, and there is vacation of 2 days per week with the collaboration of NGOs and community counselors who made the counseling for HIV. The key feature of prison situation in Côte d'Ivoire is like that in most of African countries, there is a limited medical care, there is an overpopulation of all the prisons, a high mortality rate, a lack of hygiene. Two years ago, there is a cholera epidemic in 4 prisons in Côte d'Ivoire. There are drug and alcohol dependence, homosexuality, sex workers, and poor diet in all the prisons, where most of them have just one meal per day. And this year, there has been many cases of beriberi. Just to see the overpopulation. So the strategy to fight HIV and TB in prison in Côte d'Ivoire is to provide screening to all inmates and the staff of the prison also. For the tuberculosis is to make screening at arrival and to externalize sputum analysis, because there is only one laboratory in the main prison in MACA. In the other prison, there is no laboratory. So the sputum are externalized to the hospital of the region. For HIV, with the support of the community counselor, is to offer of testing on arrival of all the people, and also to make biological assessment if the people are HIV positive. And for the prison who has no medical doctors organization is to bring doctors to the prison two times a week. The strategy to fight HIV in prison also is to provide treatment and care to all, to everybody. For the people, for the tuberculosis, is to make an isolation of TB patients and a contact tracing, and to make the DOT strategy with direct observed treatment. So the HIV is to initiate of treatment and the follow-up in according to the national protocol of Côte d'Ivoire. Those possible in adequate and sufficient food with dietary supplement when possible. It's also to advocate for health and rights in prisons, and to design a model of intervention replicable in all prisons. Of course, is to respect also confidentiality and rights when possible. The program of ESTHER has contributed to the writing and the validation of the first national recommendation for health in prison, and it has been signed this year by the two ministries, Justice and Health. The result of national program of tuberculosis for 2013 showed that the support of TB patients in prison, the new cases of pulmonary tuberculosis in all the prisons were 54, and within 29 only for the MACA, and all the forms of tuberculosis were 85 and 61 for the MACA. Our result from the program who has been extended with the aid of the Global Fund at 8 prisons for the HIV program. So in 2013, the result that I show you, 18,000 inmates offered HIV testing. The take-up rate was 76%. And the result of the rate of HIV in those prisons, we saw that there's still the same difference between women and men. Men was 2.9, and women went 10% of HIV positive. With the help of Global Fund, we have extended our program now to 12 prisons. And this is the result of the first quarter of 2014, TB among HIV patients. The results show that in Abidjan, the co-infection, the TB co-infection in HIV was 6%. In Boaké, which is in central of the country, it was 67%. And in Mans is a town in the west, it was 9%. For the MACA, the main prison, there is a typical treatment center in this prison. This is the only one. It's a treatment and care center and a referral center for other prisons who refer the cases who are difficult to take in charge in the other prisons. The center should be replicated in other regions if possible. And the result of the activity in 2013 showed that there is 24 new cases of tuberculosis, and the extrapulmonary tuberculosis was 8, and the co-infection with HIV was 7%, so 22% of co-infection. The key challenges of the situation of prisons in Côte d'Ivoire is the lack of services in prisons. There is only in MACA that there is doctors. So this is why this project is trying to make a better health for the prison. There is also a lack of qualified health personnel. There is a poor diet, only one meal for the most of the prison, and generally this meal is a mixed up and very poor in quality. And all the prisons are overpopulated. There is no prevention tool and policy for HIV and sexual transmitted infection. The condoms are prohibited, even though the authority know that there is sexual activity in prison. There's a difficulty of patient or follow-up on release. and their poor data on drug resistance. This is why, in collaboration with INRS, ESTHER will make a study on multi-drug resistance for tuberculosis, and the study is supposed to start in November of this year. In conclusion, I could say that screening TB and HIV in prison is a major public health priority. There is a need for better health services and qualified persons, a comprehensive patient management critical for reduction of drug resistance and transmission, and the need of additional financial resources for better health in prison. The project ESTHER is advocating for health in prison. It has been able to finalization and a political validation of the first national recommendation of health in prison. I would like to thank every people who has made this project possible. There are many, I can't say everybody, but I will just want to particularly thank people who made my arrival in Melbourne possible. I say Gilles Raguin, Eric Fleutelot, and Nadine Legray. Thanks for all.